here as well, but I just 2 weeks ago somehow passed my PhD, so I'm now fun. Welcome. We welcomed Sir George here last week, and he just rocked it with all the medical students talking about social medicine. And welcome Joanna Ralston, who delivered her children at this institution many years ago. So I wanted to give you a case study on how Web 2.0 technologies and social media can and should be levered to engage young people, students and young professionals, and how we've used this in the YP-CDN, or the Young Professionals Chronic Disease Network, to really incubate and formulate and finally disseminate policy positions that nudge the debate along. So for the talk, I want to go into a challenge that I received from the Institute of Medicine, talk about network creation, talk about how it is that we try to collaborate together. And finally, building on the talks earlier, what do we do now at the end of the beginning, if you will, in terms of taking this movement forward as a broad-based social movement? So number one, I was once asked after a talk at the Institute of Medicine on some of my access to medicines work. I'm a malaria researcher by training and have worked on organizing symposia from this podium with students on neglected diseases for years. And I was asked by one of the mentors at the IOM, Sandeep, are university students and young professionals that you work with, are they interested in non-communicable diseases? Is this something that captures their interest? And you know, I traveled a bit, and my answer was no. You know, I felt that there were these perceptions that NCDs, particularly viewed from youth, were still not something sexy, that they were diseases of the rich, the old, and critically were self-inflicted. And for this audience, this is nothing new. There is a branding problem with these diseases for social media concerns. But I went home, I thought the IOM challenge, if you will, was quite a serious one. So I went home and challenged myself and said, is this really true? So I wrote to 12 colleagues who were MDs or PhDs in public health from 2 high-income countries and said, what do you think? Do you think NCDs are something that you would devote your lives to that is a social justice concern? And their response actually surprised me. They said, are you kidding? Of course we young people are interested in devoting our careers and our lives to tackling NCDs. We believe in health for all. So how can you not tackle NCDs as a social justice issue if you believe in that? So they then wrote to their colleagues, and sooner or later we had a Google group of about 60 members from about 10 countries globally. This is March of 2010. So at this point, Harvard Medical School has something called the Global Health Delivery Project, and they kindly offered to host us on their platform. What's interesting about their platform is they have connections to global health practitioners in all spheres, so from HIV/AIDS to community health workers, health systems, and tuberculosis infection control, and so on. So we migrated these 60 people into a network hub on Global Health Delivery Online, or GHD Online. So we had a listserv effectively, and we shared information, we challenged each other. But then about last year, around this time, students started to get restless and said, you know, is this thing just a listserv, or is there something more here? Can we begin to self-organize and to push ourselves to come up with something and assert our values? So I started to see something interesting. I mean, the scientist in me sort of saw the evolution of this, and it was like a petri dish, and things started to grow. And we formed a steering group, and we had a global teleconference from people from Bangladesh, India, Rwanda, all came on for an hour and a half and talked through the issues at play. And then some people said, you know, we're very interested in tobacco control and making that interesting for young people. It's typically not viewed as interesting by young people. Building a social movement by youth and for youth. And that gave birth to something called the NCD Action Network that Phil Baker will talk about in a moment. Talking about what we as young people, as students and as young faculty in institutions, think about building new capacity and curricular changes in our training and education platforms. Talking about country-level case studies. But the unifying vision, I have to say, for all of this is that NCDs are a social justice issue. And critically, they must be treated as such, as a fundamental matter of human rights. All right, so now we're left with this. Oh, so then we, at Boston, Partners in Health kindly sponsored our side meeting for March this year. So people all across the world converged. Shweta Kandawal, who's Srinath Reddy's star student, flew in from India. I see Vishal Marwa, another YP member in the audience, who's sitting here, is a student of Valentine Fuster. So what I saw here was a lot of intellectual capital. The sort of the stars of tomorrow who wanted to work together today, who were mentored by some of you in the audience right now. Also, my younger brother, who's an undergraduate, came and changed his major after this talk. He He was focusing on biology, and he changed it to the social determinants of health. So we started to build something here where people were inspired, were moved, and started to incubate. All right, but people still wanted more. So people were happy that we had a listserv. People were happy that we had kind of a community. But what were we going to do with that? So a proposition by Andrea Feigl and Karen Siegel was, what if we could self-determine our values, our recommendations for the United Nations delegates for this meeting, and critically not just tell our leaders what we want them to do, but tell them what we will pledge to do in return for their actions, so our commitments to the world. So we started using Google Docs. Basically, we started drafting our recommendations, and I just show you a version here where we had 38 people who were on the listserv from around the world come on, and in real time we would just go back and forth. We would challenge each other and say, well, back that up, provide a reference, and so on. It was sort of like a negotiation, if you will, but a transparent and an open and a public one. All right, so this then became what we call the Youth Manifesto on NCDs, our 7 recommendations and commitments. And for this talk, I won't review all of them. They were just actually published in a journal by the World Heart Federation, and I have some copies upstairs. But one of them was asserting the rights of the child. We as young people realized that this epidemic was going to hit us the hardest in 2030 or 2040, that we really needed to think about the origins of NCDs, but following it across the life course. We believe that we need to amend a little bit, a lot of it actually, the way that young people are trained in these institutions. There's still a very tight focus on biomedical and clinical determinants of health. I can say as a medical student in the United States, there is not a lot of interest in talking about economic or social or psychosocial determinants. We need to give young people the ability to be at the high-level meeting at the World Health Assembly, and we've had incredible opportunities to do that. But that helps build young leaders. And finally, we need to think about access to essential medicines in the same way that we thought about them 10 to 15 years ago for infectious diseases. All right, so then we actually started to team up with some of you guys. So Nalini Salagram, who's in the audience here, pushed us to think not just beyond, or to think beyond the UN speak and the policy speak. That doesn't really resonate with young people. But to get into the journals and the blogs that young people read. So the Huffington Post. So we started to position NCDs as a social justice and a human rights issue, focusing on women, focusing on children. I think someone in Kuwait retweeted this, so it started to spread a little bit as well. We started to build movements with other human rights organizations. So we communicated with through Google Docs and through Skype. So Doctors Without Borders and Oxfam, other student organizations on the Access to Medicines plank. Another young professional member was very interested in mental health and started to slowly build a community. And she's now put mental health on somewhat of an agenda. And she got the Liberian Minister of Health and some of the US government delegation to meet informally to talk about the future of mental health. I'm sure a lot of you know that there's been this sort of false dichotomy between the HIV world and the NCD worlds. So again, using social media and tweets, we got in touch with the largest HIV-positive network in the world, led by Greg Gonzalez, and issued a statement that we stand together, and that the HIV community, the NCD community, the malaria community, we all stand together to fight for a successful UN summit. So this was helpful in using that edge to nudge policy. That still left us with, where are we now in terms of actualizing the movement? We have 335 people across 43 countries, but this meeting is going to end on the 19th and 20th. Phil Baker and I last night were looking at some of the numbers, right? So NCDs by the numbers. So we all know that there's 36 million deaths per year. What that means is that there's 98,000 per day. There's about 4,000 per hour. There's about 68 per minute. There's about 1.1 per second. So by the time I just said this, 10 people passed away to an NCD. Now, I don't have to tell anyone here that in the face of proven effective solutions, this data, one person dying every second to an NCD, is a social injustice and cannot and will not be tolerated. Now, students and young professionals have been at the center of many previous civil rights and human rights movements. Civil rights in this country, the anti-apartheid movement in South Africa, the HIV/AIDS movement 10 years ago. And Sir George always asks, why is it that the young folks, why is it that we don't have these social outrage for NCDs? And it's true. How many rallies for a 42-year-old diabetic smoker in Bangladesh have you been to at a university or that you've organized? I can say that I've organized none. I've sat here and done it for neglected tropical diseases and for malaria, but not for NCDs. So let's change that. So we're proud to announce a youth rally I actually have the permit from the New York Police Department, so we have the legal right to assemble, and we have a sound permit to make noise. So we're going to bring it. We're going to bring it. And to Sir George's messages of bringing placards, we invite all of you to show your outrage, to come join us. And that youth spirit of challenging the status quo is something that we never want to lose. And we see in a lot of you that many of you are, quote, young, because we think young is attitudinal, not physical. So this is going to be on this is going to be on Monday, September 19th, while the UN leaders are meeting at 8 a.m. And it's going to be at 47th Street and First Avenue. Spread the word, tweet, and so on, please. We want to get as many people out as we can. We think it's one of the first student rallies on NCDs at the United Nations ever. So we want to mark this historic occasion with a historic rally like our predecessors in human rights have done. Finally, in thinking about apartheid, I was struck with the invitation that students fighting apartheid gave to Robert Kennedy in a lecture at Cape Town. And many of you probably remember this speech. Each time a man stands up for an ideal, or acts to improve the lot of others, or strikes out against injustice, he sends forth a tiny ripple of hope, and crossing each other form a million different centers of energy, and daring those ripples build a current which can sweep down the mightiest walls of oppression and resistance. I have to think that each tweet, each text message, each blog is a tiny ripple of hope from anywhere in the world, any student in the world, from Denver to Dhaka. And that can together synergize and bring down resistance. I thank you.